So please start my videos. This is a surgical video of my procedure treating the patient suffering from epileptical membrane. So the contact lens and using 3D system allows us to have a better resolution than the conventional operating microscope. After complete removal of epileptical membrane, I routinely remove the internal limiting membrane stained with ICG with a 25 gauge vitreous forceps. So contact lens and gives us a higher magnification as David shows, and we have the better and higher resolution with Ingenuity system with the contact lens system. This is another case of retinal detachment due to the macular hole in the highly myopic eyes, and and with Ingenuity system. This is the diamond dust scraper. It's very useful to remove and posterior hyaline membrane stained with triamcinolone. As you can see, triamcinolone stained membrane is easily removed with this scraper. After removal of this membrane, I routinely remove internal limiting membrane stained with ICG with a 25 gauge vitreous forceps. And it's much easier to perform LM removal with the 25 gauge vitreous forceps and with the Ingenuity system. And then LM flap is put inside a macular hole to close the macular hole. And it's very interesting that we have a good image, the fluid gas exchange. This is another case of a large macular hole in highly myopic eyes. I decided to perform autologous central retinal transplantation, and in this case, because inverted flap technique, which is a conventional and a technique to close the macular hole, is very difficult to close large macular hole, and which size under about 1,500 micrometers. So I'm checked, and this is and the images from contact lens with Ingenuity system. You can check the size of large macular hole, and then I checked which design, which size should be harvested and from nasal inferior side of the retina, and then I'm marking the diatemy. So the edge of the retina, and then I tried to make a small piece of retina with using vertical scissors. But this surgical technique is a little bit challenging because this size is very too long, and the actual length of this size is probably 30 millimeter. So it's very difficult to harvest a small piece of retina. But I make a small piece of retina which size is designed to same as a large macular hole. And I put the perfluorocarbon rigid into this eye. The piece of the retina is moved to a large macular hole with a bit of forceps. I'm trying to grasp the piece of retina, and so it's very difficult to large and too long. So, but the Ingenuity system allows us to have still and gives us a better visualization and a depth of field. And then, the small piece of retina is covered with a large macular hole, and I make sure good orientation of a harvested retina under perfluorocarbon rigid. And then I checked again the size of the harvested retina and the position of the retina, and it's the right position covering the large macular hole. And after that, I performed the fluid gas exchange and not to displace and harvested retina. And it's very interesting, the fluid gas exchange, and I was able to have a good images. This is the next case. The eyes with a large macular hole in the standard actual length size. It's much easier to perform autologous central retinal transplantation. This size and the size of a large macular hole is about 1,221 millimeters. It's almost difficult to treat and by the conventional and surgical procedure. So I decided to perform ART and a surgical procedure and a small piece of retina covered with a large macular hole. I routinely use a chandelier illumination and with a 3D and a system because more light allows us to have a better resolution and without and then compared with without chandelier illumination. This is another case of massive submacular hemorrhages due to PCV. We have a lot of PCV patients with submacular hemorrhages. This is emergency cases because the macula was infected with the submacular hemorrhages. So I using a 3D system, 3D engineering system to inject air into subretinal space. Before injecting TPA and to dislodge some macular hemorrhages, and then I injected the air into a submacular space with microneedle. Which size is a 47 gauge microneedle. It's the smallest one in the world. This is a last case, and can you see? And can you guess which disease? This disease, we can see a cherry red spot. This is a patient with a CLL patient. This patient visited our clinic 24 hours after his onset. So I decided to have a cannulation for this patient. This is a very good timing to dislodge the emboli, which is present in the lamina cribrosa. Engineering system and it's very, very nice for us to perform delicate procedure like this, and such as a cannulation or a transplantation. So the cannulation microneedle pierces a central retinal artery to inject a TPA into a central retinal artery. Probably the contact with emboli to dislodge emboli. And then I checked any bleedings from the left hand with a soft tip needle. So I make sure there is any bleedings at the end of surgeries. So finally speaking, my surgery will be done 100% with a 3D engineering system. And one reason it gives us a high resolution, and then compared with the conventional operating microscope as well as depth of field. Thank you very much.